guys, what's up? Mama Dr. Jones, OBGYN, and mom to not 8, just 4. That was awesome. Not 8, I don't have 8 kids. OBGYN and mom to 4. I might be okay with having 8 kids, but I only have 4. Today we're talking about IUDs and the IUD horror story that Molly Burke recently posted and a bunch of you sent to me. If you don't know Molly Burke, she is an amazing YouTuber who is blind. She is dispelling myths. She is doing excellent work. If you don't know her, which at this point, honestly, I don't know why you know who I am, but don't know who she is. Her channel and the video we're discussing is linked in the description. Basic overview of IUDs. There are 2 types, progesterone and copper. Between 2008 and 2011, the rate of unintended pregnancy dropped by 6%. In effect, a decrease in abortions and a decrease in people having babies who didn't want to have them right then. These are good things. The reason for that is multifactorial, but most people believe that IUDs played a significant role in that reduction. Everybody should have access to be empowered to control their reproductive decisions. That should not be based on your socioeconomic status. I am a proponent of access to contraceptive forms of all kinds in all people, period. No pun intended. While I recognize that an IUD is definitely not for everyone, and we're going to cover some problems with IUDs in this video, I do think they are a really great option for a lot of people and something that you should talk to your doctor or advanced practice provider about if you have questions about it. Can't ask me unless I'm your doctor. I can't believe I have to say this, but I'm saying it. Personal medical advice should be directed to somebody who personally knows you. Don't send me personal medical questions. It happens a lot, you guys. I get a lot and I can't read them all. It is very frustrating that my inbox is filled with personal medical questions. Like, just save us both the time and don't send it. I'm not trying to be rude. It's just like illegal for me to give you medical advice when you're not my patient. Good. Now that we've established that, let's move on.
My IUD horror story. Oh Lord. I do believe that like female sexual health shouldn't be taboo, and the reality is these are things that all women have to talk about and deal with at some point in their life.
50% of the population around that at some point in their life has had a period, and I think that the fact that it's been something we were ashamed about or quiet about or couldn't talk about for so long is why we are not at the point we should be with making advancements in how we manage periods and how we make people more comfortable during their periods. Things like this, things what Molly is doing, talking about her period, talking about problems she's had with her IUD, bringing these things to a conversational level, and what I do here on this platform, these are the goals. The more we make this a common, easy to talk about thing, because it should be, because it's normal, the more we're going to advance how we're doing in helping make those things that we feel are pain points in our life a little bit better.
That's annoying. I'm trying to film. Does nobody have respect for the sacred job that is being a YouTuber?
Can I just add in here, I love what she has going on with her hair and lipstick. It would be a beautiful, happy day for me if I could rock that hair and lipstick. I love it.
You have low protein S in your liver. I am more at risk for blood clots. Birth control pills, you cannot take them if you're at risk for blood clots because it also heightens your risk for blood clot. Yeah, no understanding. So I don't know why this is. I'm sure somebody in the comments could like explain it if anybody's interested.
I found somebody who's interested. Protein S is a enzyme. Protein S. It's a protein. What is it? It's a protein. Okay, protein S deficiency, which I probably knew a lot more about like 6 years ago when I was acing my med school exams. Usually an inherited disorder which is passed down from families. In rare cases, it can also be something that is acquired that you get, so things which cause the liver to decrease their production of protein S. You can have certain situations where that is lower than it should be. Its normal function is to work with the what we call clotting cascade. I can't remember fully, but I think that what it does is binds to another factor which causes a decrease in clotting. So when you have too little of protein S, you don't have that binding, can kind of go crazy, and then you're at an increased risk of blood clots. I don't know her full history, so this won't be applicable to Molly, but in general, people who have protein S deficiency should not be on any kind of contraception which contains estrogen. And the reason is because estrogen increases your body's ability to form blood clots. At baseline, that risk is not so increased that it makes contraception risks outweigh the benefits. But in somebody who already has an increased propensity for clotting, that would be enough to put it over the risk-benefit analysis and no longer make sense for someone to use. CDC has a great list which kinds of contraception are safe for those medical issues on a scale of 1 to 4, with 1 being the safest and 4 being not worth the risk. For inherited thrombophilias like protein S deficiency, estrogen-containing contraceptives would definitely be in the don't use them section. So I'll link that below in the description. Anyone with a contraindication to using estrogen would usually be recommended to use a progesterone only or non-hormonal type of birth control. So that would be things that were like condoms, diaphragms, etc. That would also include long-acting reversible contraceptives like IUDs and the one that goes in your arm called Nexplanon. There is a progesterone only pill and an injectable progesterone. Importantly, those options are not going to be good for everybody who has a contraindication to estrogen. And she's saying her doctor told her that really the only safe thing for her, given her history, which we don't know all of and we can't comment on, would be an IUD. And so that is what she decided, I'm guessing based on the title of this, to go with.
I didn't want to research the side effects and then convince myself that I was experiencing them. I was just like, you know what, Molly, just go into this open-minded, don't freak yourself out. And at the time, I had a horrible family physician who was like, side effects don't exist. No medicine has side effects. All of that is just for legal reasons. She was a crackpot. She'll come into play. I don't know if not researching the side effects was smart or not.
It depends on the person. For some people, that is extremely anxiety producing because you may not, and for the most part, you likely won't fall into the category of people who have every weird side effect. For some people, they just want to know and be informed, and I think either of those is fine. You just have to know what is best for you. The most common side effect when you place a progesterone IUD is irregular bleeding and cramping. This can go on for any period of time, but for the most part, people who have weird bleeding, whether it be heavy bleeding or continuous spotting or bleeding that goes on and on for a prolonged period of time, that generally will go away completely within the first 90 days. For a lot of people, it's not bothersome bleeding. And for the people who do have really bothersome bleeding, there are some things we can do to help mitigate some of those side effects. Almost everybody who gets an IUD will have light or no periods when we're talking about progesterone IUDs after the first 3 months. And for most people, it's way before that. So that's kind of the normal path of progression that we see.
I could be put under general anesthetic, if I could get laughing gas, if I could have something to ease my anxiety, and I was told no. I have since learned that in many countries around the world, getting an IUD inserted is a surgical experience. You are completely put under, or at minimum, given laughing gas.
So obviously I can't comment on other countries. I don't know where she's talking about that has IUDs put in as a surgical procedure. Based on the literature and my experience with placing IUDs, I would say that the risk of going under general anesthesia is going to be far higher than the benefit that you receive from this procedure being done under general anesthesia. The laughing gas thing, I mean, I think that's a wonderful idea. Unfortunately, at least in the United States, and I don't know how it works in Canada, it's really hard to get your office set up to be able to provide that. And I personally would not be able to provide that to my patients because we don't have access to nitrous oxide in our clinic. IUD placement in somebody who's never had a baby, it does tend to be more painful. I don't know that in everybody it's terrible. I've placed a lot of IUDs in people who've never had a baby. It is painful for almost everybody who has an IUD placed and has not had a baby, but for the most part, I would say those people do extremely well with it. So I think it's very person dependent. As far as managing anxiety, if I have a patient who's extremely anxious, there are options for that. I don't know that you know, we have really good guidance on who that should be offered to, and obviously every person doesn't have that as something that they offer to patients, but I do have a couple of options for medically helping to manage that. ACOG has a whole committee opinion that goes through all of the literature and lack thereof about things that we've looked at that we hoped would be helpful that really didn't pan out to be super helpful. Talking about this makes a difference. I will say that one more time. We need more research. We need more investigation. We don't need to be using things that don't help, which a good portion of things that we've looked at don't help. Hopefully there are ongoing studies, and hopefully people talking about this being an issue will help us find something that is better, because there should be better options for people who experience significant pain with their IUD insertions. That should not be the barrier to getting a safe and effective form of birth control.
I was told to let the muscle relaxant melt under my tongue, to take one the night before and one the morning of. I go into the bathroom and I have diarrhea. I end up going to the bathroom, I want to say 3 times before my appointment. She's like, how are you feeling? And I told her what was happening, and she was like, oh yeah, I mean, you took muscle relaxants, like it relaxes all the muscles, including your bowels, like everything in your body is relaxed. So I was like, oh great, could not like the pharmacist nor you tell me prior to taking them that you'll probably experience horrific diarrhea on these muscle relaxants? No? Thanks guys. Thank you.
I don't know for sure what muscle relaxant she's talking about, although there are some people who use a medicine called Cytotec to help soften the cervix, and that could be a potential side effect of Cytotec or misoprostol, and it is a medicine that dissolves under the tongue. So I don't know if that's what she's talking about or not. That is a medicine that some people use. The literature's kind of mixed on how helpful it is. How do I say this? Some doctors prefer not to use it because the side effects can be significant, and the literature is, some say maybe beneficial, some say not beneficial at all. And some people choose to use it because they see that some benefit potentially there is important to them. Absolutely, if anyone gave her a medicine that has a really common side effect of terrible diarrhea, yeah, I agree. Somebody probably should have mentioned that.
Some countries like won't even insert IUDs unless you've already had kids. A lot of women don't even receive IUDs unless their cervix has already like expanded and contracted prior to this. Not Canada.
There is a very old belief that you shouldn't put an IUD in somebody unless they've had a baby, but that has proven time and time again to not be an important consideration in the literature. And at least in the United States, American College of OB-GYN, the CDC, American Academy of Pediatrics, all universally support use of IUDs in patients who have not had a baby, if that's something that they desire. The American Academy of Pediatrics goes as far as to say adolescents who are less than 20 and sexually active, a long-acting reversible contraception, including the IUD, should be their first-line choice for preventing pregnancy. I can't comment on other countries and how they do it, but the literature is extremely supportive of using IUDs in patients who've not had a baby before. And the reason for that is there are several studies that have looked into IUD use in adolescents and shown a very high chance of continuing that form of birth control past 1 year. I think it's like 85%. Greatly decreases the risk of unintended pregnancy and the rate of abortion. There's a lot of benefits of IUDs. Of course, there's risks too, and that is absolutely something that people should have presented to them and discussed before placement, but that doesn't mean that they shouldn't be used in people who've never had a baby. I can't comment on any other countries, but that's how we do it here. I will link below the studies that support that and the reason that we do that.
Gynecologist was not very pleasant. She was not very kind. She was not very compassionate. Speculum? Oh my God, you guys, I seriously don't know things. She like cranks me open. She takes a, I'm sure there's an actual term for this, but like a metal straw, and inserts it into my cervix to make sure that she will be able to fit the IUD.
That is called a uterine sound, and it does make sure the cervix is open enough to place the device, and also allows you to measure the length from the outside of the cervix to where you need to place the device so that you can place it in the correct place.
At this point, I'm just like freaking out. I'm like, oh my God, get this shit done. Oh my God, I never swear on my channel. Here's an image of what an IUD looks like. I believe, I am like 99% sure I got the Mirena IUD. And I believe IUDs are like something like crazy, like 98.9 or 99% effective in birth control. But I also believe that if you do get pregnant on an IUD, you have to get an abortion because it's like super unsafe. I'm gonna link.
Okay, that is not true. Well, part of that was true. IUDs are extremely effective forms of birth control. If you get pregnant on an IUD, meaning your IUD fails, that is very rare, but if it happens, the risk of that being in the wrong place, meaning in the fallopian tube or on the ovary, something like that, is much higher than someone who gets pregnant without an IUD in place. So step one is figuring out, is this a pregnancy that's inside the uterus with the IUD, or is this a pregnancy that's outside the uterus somewhere which would be overtly dangerous to the patient? Once you've figured that out, and decided it is inside the uterus, there needs to be a discussion of, is this a pregnancy that you want to continue? Because clearly this is an IUD and somebody who is trying to prevent pregnancy, and that has to be a discussion that you have with the patient. I am ethically obligated to have that discussion with the patient. In patients who decide they would like to continue the pregnancy, you don't have to have a termination. It's certainly not something you force someone to do. You do have to decide what to do about the IUD. So pregnancies which are in the uterus and an IUD is also present in the uterus are at an increased risk of miscarriage, infection, and preterm labor. Management of that depends on where the IUD is located, meaning is it lower than the pregnancy? Is it all the way in the top of the uterus? Do the strings come out of the cervix where they're visible? In patients who have an accessible IUD and a pregnancy inside the uterus, removing the IUD decreases the risk of pregnancy loss, preterm labor, and infection. It does not decrease it to the baseline risk of those things for a person who got pregnant without an IUD in place, but it does significantly reduce that. So in a patient with a desired pregnancy, an IUD which is able to be attained, meaning you don't have to like go in surgically and get the IUD out, the IUD should be removed. In a patient who that can't be done, there needs to be a discussion about the continued increased risk of all those things we talked about, but they don't have to get a termination. And in fact, I would say a lot of patients choose to continue a pregnancy even if the IUD can't be removed.
So the IUD is like a metal T. The reason she was putting the metal straws in was because when they insert it, it's like the shape of a metal straw, and then they release and the T arms like pop out and like clamp into the sides of your uterus, and that's how it works.
That was a great image of how an IUD goes in. They don't really clamp into the side of the uterus. You may not have meant that, but that drew into my head an image of an IUD going in and then like attaching. They are smooth pieces of material. They don't have like claws or anything on the end. They just go in and you put it in straight like that, like you saw in that image, and then you allow the arms to come out, and then once they have deployed, it just sits there on the inside of the uterus. It doesn't attach to anything. I mean, we don't want it to attach to anything. Certainly there are situations where the uterus forms scar tissue around that, which can make the IUD hard to remove, but 99% of the time it just sits there doing its job, releasing a small amount of progesterone with a primary mechanism of preventing fertilization, keeping the sperm away from the egg.
The moment those T arms with the little claws on the end like go out and clamp into my uterine walls, I screamed bloody murder. And my mom is like holding my hand. She's like, it's okay, breathe, breathe, it's all done now. And the doctor just looks at me and goes, well, you're ready to have kids now, which obviously she doesn't mean because I'm like ready to get pregnant. She means because of all that pain I just went through, I'm ready for the pain of labor and delivery, which I've never given birth, so I can't compare. But just her saying that when a patient is like screaming in pain is so cold. And
okay, totally agree. I don't know why anybody would handle that situation like that. So first off, what she's probably describing, because we've already addressed that there's no claws inserting into the uterus, but what she's describing is probably a uterine contraction. The uterus was irritated and it contracted significantly and caused her to have a lot of pain. That can happen with an IUD insertion, and it's not out of the realm of normal. But what is not in the realm of normal is treating someone like that. There should be a compassionate response to that. I'm so sorry, I wasn't trying to hurt you. You probably had your uterus contract down. It should be gradually getting better. You stay laying here until you're feeling a little better. Like, what the heck? I am sorry for my whole specialty that there are people out there who are that callous.
So I was supposed to like wear a pad after getting it inserted. Well, let me tell you, friends, I bled for 30 days straight. I bled. This wasn't like intense period bleeding level, but it also wasn't just like spotting. I'm obviously concerned, and I'm checking in with my gynecologist about this. They did both an exterior and interior ultrasound. If you have ever had an interior ultrasound, again, I'm sure that's not the actual name, but it's where
vaginal ultrasound, an accurate description though.
IUD was tilted, and so one of the claw arms of the T was like digging too much into the muscles of my uterus, and that was causing it to bleed. Like, the muscle should eventually push it up and it should be okay. And after about 30 days, I stopped bleeding, cramping went away, and I was a happy camper with my IUD.
Most people do not have bleeding for 30 days in a row, but that is within the realm of what can happen when you have an IUD placed. However, there's a few things that you can do to minimize that. Don't want to imply that that's what should have been in her situation. It's individualized to the patient. I also want to comment here that one of the reasons she's probably so frustrated at this point is because there wasn't a discussion before it was placed that this could happen. So sometimes people do have prolonged and unusual irregular bleeding for even up to 90 days. And again, if it's happening daily for 90 days, we have things we can do to help decrease that and hopefully make it better, but it can happen. And had she known this before, she probably would have continued to be utterly annoyed, because let's be real, who wouldn't be annoyed if they had 30 full days in a row of period bleeding? But she may not have been worried, and it does sound like there is some element of worry or anxiety that something bad was going on. I think that counseling plays a role in this.
Life continued on. I stopped getting any period. That was the next side effect I noticed. I had 0 periods for 4 months, but I was like, you know, I've heard of people losing their periods on birth control. I'm personally not a huge fan of that idea. For some reason, again, there's probably like no scientific fact behind this, but I feel like periods like clean me out. I don't know, it feels like a flush for my body. Like, I'm like, oh, it's like cleansing to like have this cycle every month and renew. I don't know. That's maybe my weird like hippy dippy thing, but I just like the idea of like flushing out.
I think this is important too, because people who want to have a period each month should know that a large percentage of people using a Mirena IUD will not have a period each month. And she's right, there's no scientific reason that if you're using some form of birth control, you have to have a period each month, but that doesn't mean it's not a valid feeling for someone to want to continue having a period each month. So that also feels like especially a major failure in counseling, because that's a really common side effect of the IUD. Not having periods is dangerous if we don't know why it's happening. If somebody is not having a period each month and we know why, they are on birth control, they are pregnant, they have gone through menopause, those are okay reasons that it is medically safe not to have a cycle each month. If somebody is not having periods and they don't know why, and they're not on any form of hormonal contraception, and they're not pregnant and they're not in menopause, we should check that out, and it can be dangerous. In this case, it's not dangerous, but if it's bothering her psychologically, then it's important to know that she would prefer to have a period each month, and that's a valid thing for somebody to feel. I have patients in my clinic every week who prefer not to be on continuous pills or not to use a Mirena IUD because they don't want to not have a period every month. Importantly, she didn't have a lot of other options, and she was trying to manage her uncomfortably heavy and painful periods by getting the IUD placed. That statement of, I had heard that maybe sometimes people don't have periods on IUDs, makes me think that nobody mentioned that ahead of time, which, I don't know. feels important.
Wasn't experiencing any other side effects. What I felt was like really confident in not getting pregnant in my relationship. Great, got this for 5 years. Like, boom, I'm good. I'm golden. I don't have to worry. This is great.
Okay, so my assessment at this point is she had a terrible insertion process. That doesn't always happen, but it can. And then she had a really frustrating side effect profile for the first month. After that, she became very happy with her IUD, at least for a period of time. I don't know where this story's going, and I'm assuming there's more to it, but for a period of time, she was happy with her IUD. And for the most part, whatever your bleeding cycle is and side effect profile is in the first 3 to 6 months is probably what it's gonna stay after that. So I do encourage people to keep their IUD in long enough to let that initial weird bleeding and cramping even out and figure out exactly what their side effect profile is and what their bleeding profile is going to be with the IUD in place. And that sounds like where she's at right now with it, and that she's kind of in a happy phase of the IUD.
I was telling all my friends, like, girl, get yourself an IUD. Like, it is very painful at the beginning, but it is worth it. Like, I feel so confident. I feel so safe. I don't have to worry. Boy, did things change. I started noticing, like, all of these symptoms. I found lumps in my breasts. I was bloated. I was getting pelvic pain. I was getting dizzy spells. I was getting nausea. I was getting headaches. I was just having like all of these weird things.
So these are some less common but definitely possible side effects of an IUD. An IUD has progesterone in it and it's locally acting, but a very small percentage of that does get absorbed into the bloodstream. So there can be what we call systemic or body-wide side effects that can result from IUDs. I will again say these are way less common than unusual bleeding, and most people end up happy with their IUD. About 85% of people choose to continue using it for at least a year. However, there is no doubt in my mind that some of the symptoms that she mentioned can be associated with progesterone and could be a result of the IUD. I, as a doctor, would want my patient to come in and tell me, hey, I'm having all of these things. Do you think there's any way that it's related to my IUD? I hope that's what she's going to do, and I hope that her doctor is going to take that seriously. I am seriously questioning that based on the previous discussion of how her doctor interacted with her at the time of placement.
And I found forum after forum of women sharing Mirena IUD horror stories. Some similar to mine, some worse. And I was like having hair loss, which when you look it up, all of these things are in fact known side effects of the Mirena IUD.
Known side effects, but very uncommon side effects. They do happen, but they are not the norm. Most people don't experience them. That doesn't mean she shouldn't have, or she didn't, or that it's not related. It just means they are side effects that most people don't have terrible problems with. I would like to say, be careful when you're looking up side effects in forums. Although they could be very valid side effects and concerns, it tends to put us in this echo chamber where nobody who gets their IUD and is having no problems with it goes on a forum like that or makes a video like this. You will see people who are having side effects talk about that a little bit more often, probably because they're seeking commiseration or help or advice, but it does tend to make these things pop up more often in social media and the internet. Does that make sense? Like, I don't know if I'm making sense. The amount that I see people have those side effects clinically is far lower than the amount of people I would think have those side effects if I just looked it up on the internet. And that is absolutely not to say that Molly didn't have these side effects and that they weren't related to IUD, because I certainly think they probably could have been based on what she's describing and the way that progesterone works.
Based on all of these side effects that I was experiencing that are related and known to be IUD Mirena side effects, I decided I was going to get it removed. I call my family doctor, who is the one who believes that side effects don't exist, and it is just for legal reasons that companies disclose side effects.
That is, she's a crockpot. Isn't that what she called her at the beginning? That is the most ridiculous thing I've ever heard. Of course side effects exist. Not acknowledging that does not help the problem. Side effects exist. With any medication, it's going to be weighing the benefit and what the medication does to help you with the risk and what the medication does to annoy you. And if it's higher on this side, then the medicine may not be for you. And if it's higher on this side, then you may be willing to put up with some minor side effects. It kind of depends on how bad they are and what you're treating with it. She is clearly stating, I am having side effects I think are related to my IUD, which are not worth it to me, and I can't imagine why someone would tell her side effects don't exist. That's banana pants.
So I went to the emergency room. In the emergency room, they confirmed I had a pelvic infection. They told me that they had to get the IUD out right away. I was horrified, I was terrified, I was so scared to get it taken out, given the pain I experienced getting it inserted. I had a male doctor in the emergency room who was like, Molly, we are gonna take this at your pace. Every single thing we do is on your terms. Everything is up to you. I'm gonna tell you step by step what needs to be done next. And the moment you're ready for me to do that next step, I will do it. And we'll wait for the next step until you give me the go ahead, and we'll take it from there.
I literally had that discussion in my clinic yesterday, like almost word for word. I am so happy that she finally has a good doctor taking care of her, at least by the measure of bedside manner.
It was then that I decided, like, I prefer male gynecologists. Like, I've had so many females dealing with gynecological issues that have been so callous and cold, and like, I'm a woman, I deal with this too, it's not that bad. Or
okay. I think it is a travesty that she has been with doctors who are, by all account, horrible. And I am really happy that it sounds like whoever's going to remove the IUD for her was really wonderful. But I want to say this, and I am not trying to call her out because, again, I'm a huge fan of her and I love what she's doing with her platform. But somebody's compassion level and ability to have good bedside manner is not a result of their gender identity or sex. The interactions she's had with crappy doctors are because they are crappy doctors. 80% of OB/GYN providers, at least in the United States, are female, and that means that you're much more likely to see a female doctor. That means that you're much more likely to have a bad interaction with a female OB/GYN doctor. Obviously, I'm biased. I don't want to believe that that's related to your sex because I am a female OB/GYN provider and I would like to consider myself compassionate and to have good bedside manner.
we all have different backgrounds and life experiences that end up giving us experiences that are maybe traumatizing or lead us to go into certain circumstances differently. We all have different, like, you know, like, you can't say it's the same for every woman. Whereas for him, he was like, I don't know what you're going through. And despite the fact that I've dealt with this with many women, I don't know how it feels for each woman.
I'm not trying to harp on this, but it is personally important to me that we achieve a level of equality between males and females, which is reasonable. And I think in order to do that, we have to recognize that things like this are not related to what genitals you carry. They are related to how you interact with people and your personality, not what's in your pants.
Kind and compassionate as I can be, and I was so appreciative of that.
But again, I'm very happy she found someone that she really trusts and felt like she meshed with, because that is extremely important. So I'm not minimizing the fact that she shouldn't be really frustrated with the interactions that she's had previously.
So many of my side effects and symptoms cleared up, which was really nice because then we could determine what was the symptoms and side effects of my actual accident and what was the IUD affecting my body. I then went to my doctor for a follow-up. She screamed at me. She yelled at me. She told me I had no place going to the ER for something as simple as getting an IUD removed, that it wasn't a big deal, that I should have just come into her office. And I was like, dude, we called like 3 times. Your office refused to let me see you because, like, you hadn't put it in. She's like, that never happened. So needless to say, I stopped going to that doctor because she was horrible. And I switched.
What the heck? I think she's talking about the same doctor who told her side effects aren't a real thing. I don't even know what to say. That's unacceptable. It's unacceptable to treat other people like that, regardless of if you are a physician or not, but especially if you are a physician. I'm sorry, personally, Molly, from our profession, that somebody has treated you like that, because it's not acceptable. And I hope that you have gone on to find somebody who you trust, who can work with you and take care of you, and who is invested in making a difference in your life and making you feel better, because that is our job and that's what we're here for. And it just really lights a fire under me when I hear people describe stories of being in a position where they had a doctor who didn't treat them appropriately. Medical school admissions needs to prioritize whatever trait we can correlate to good bedside manner.
All around, like every step of the way of what I experienced, other than the man who removed my IUD, was pretty awful. So that's my IUD horror story.
I feel like if you took everything she's described in this story, from a terrible experience with the insertion to having side effects and having the IUD removed, the one factor that probably would have turned it all around, it may not have changed the outcome. She may have still had all these complications that she's talking about, but the one factor that I can pinpoint in this story that would have turned it all around is if she had a person on her side, her doctor or her advanced practice provider, who was clearly invested in her health. We are on the same team. It needs to be clear that that is the case. I don't know that for sure. I've not walked in her shoes. I'm sorry, Molly. I wish I could fix it. Thank you, Molly, for sharing your story. I think it's super brave of you, and I love that you were willing to put this out there. I love what you're doing with your platform, and you inspire me every day, so keep it up. If you're not subscribed, please hit subscribe. If you like this video, give it a thumbs up. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time.